My name's Kimo Thorpe. I'm on staff here at Watermark Health in Dallas, Texas. I've been on staff here for about 6 years now, and I play the role of Director of Clinical Services. We're all about redeeming healthcare, one person at a time. And so the fact that we get to sit across from people in a really hard place, look them eye to eye, and tell them, hey, there's a reason to have hope, there's a reason to have joy, there's a reason to have peace, that healing's available to them. It personally gets me excited to wake up every single day and give my best here.
My name's Samantha Parsons. I work with Watermark Health. I'm the clinic director of Watermark Urgent Care, which was one of our urgent care locations. We're passionate about mobilizing the local church into healthcare spaces. We do that by providing excellent healthcare, but also spiritually engaging every patient, providing a ministry opportunity.
What we're all about here is talking about how do we care for the individual spiritually, physically, emotionally, mentally, and socially.
I'm Jesse Collins. I'm a charge nurse at Watermark Urgent Care at our Skillman Clinic in Dallas. The area that this clinic is in is a lot of people that have been resettled as refugees here, high immigrant population. So the majority of the patients that we meet every day were not born in the US.
When you're trying to tell someone or communicate to them not just what kind of medicine they need to take or what is going on inside their body, but that they have some things about them that need to change, to do that with compassion and care, can be really, really challenging. It's hard to do that in English, let alone when you're using Google Translate or pointing to a picture on the wall. And so that is one of the biggest challenges we have here, is communicating clearly with compassion and care what is going on with the patient.
We love partnering with SpokenHere because we have a shared value of compassion. The interpreters that we interact with from all over the world that are working for SpokenHere have a great compassion in the way that they interpret, the way that we engage, the way they engage with us, the way they engage with patients. And so it really does feel like there's a third person in the room.
And so it just gives us an opportunity to think about like what we're asking someone to do and maybe change their instructions or change their next step. Help them make that like an easier next step for the patient, because we know thanks to the interpreter we're kind of a better way to help them.
Our staff and our volunteer team here would say they're so thankful for the language services that are provided by SpokenHere. Every single day when they sit down in a room, they're calling through using an interpreter and a translator to communicate really hard things, and they know that the person that is communicating on their behalf is doing it compassionately and with an empathetic ear.
So we're getting to provide clarity in which we see better outcomes out of that.
SpokenHere has been a partner, they've been a co-collaborator. They have sat across the room with us and dreamed about how can we do this better. As we've thought through scaling, as we've thought through going deeper with patients, they have walked alongside us to help us accomplish all those things.
We love our partnership with SpokenHere because it's allowing us to deeply connect with our patients in their heart language. It's a blessing.
SpokenHere, building better relationships worldwide.